Thank you, Deja. Well, this morning, we want to help you get ready to lose an hour of sleep this weekend. You have been professor of neurology and president of the American Academy of Sleep Medicine. Dr. Anita Shelgakar joins us now live. Thanks so much for being here with us this morning.
Thanks for having me. Glad to be here.
Absolutely. Well, I know I'll be missing that hour this weekend, but just how much does daylight saving actually affect our sleep?
You hit it spot on. I agree with you, and many people agree too, that losing that hour of sleep really does make us feel more tired in the morning when we're waking up, and even for the next few days after that. So while 1 hour seems like a small shift, it really can affect our sleep quality, the amount of sleep we get, and our level of alertness the next day.
Well, I know you have a team of doctors and researchers at U of M that are constantly studying sleep and conducting sleep study schedules. Is there anything actually happening to our bodies with this change that would affect how we're feeling, how we're sleeping?
Absolutely. When we shift the clocks forward, we essentially lose that hour of sleep. We cause a mismatch between our internal clock and the world around us. And when we have that type of mismatch, it really does add to increased markers of inflammation. Shortchanging ourselves on that hour of sleep can lead to an increased risk of car accidents. There are, increased errors that people can make when they're not feeling attentive. So we definitely see that there are physical and cognitive effects of the time change when we move forward an hour.
So what can we do to minimize any negative effects? Is it just a matter of getting to sleep an hour early this weekend, or is there more we should be doing?
We can certainly try to transition and ease our way into this time change. So trying to move our schedules earlier by 15 to 20 minutes each night over the next few nights can be helpful. Keeping to your consistent routines in terms of meals and going to sleep and waking up in terms of, again, our internal clock, because the clocks around us are going to change, but trying to maintain that consistency that our bodies are used to can really help with minimizing the effects of the time change, and also really exposing ourselves to bright light first thing in the morning. That helps to send an alerting signal to our brain saying, hey, it's wake up time, it's time to get going. And then when we're ready to go to bed in the evenings, even though it will be lighter outside, trying to keep our sleeping environments cool, dark, and quiet so we can fall asleep when we want to.
Okay, some really great tips. Anything that we're leaving out that maybe people just don't think about when we go through this change that they could do to make this a bit easier on themselves?
The consistent routine is really key, keeping a consistent bedtime, consistent wake up time, and that exposure to bright light in the morning and having dimness and darkness when we're ready to sleep. And also just a reminder that sleep is just as important to our health as nutrition and movement. So it's really a central pillar to our overall health and well-being.
Thank you again so much for your time this morning, and wishing you the best of luck with losing that hour this weekend too. Thanks again.
Thanks. You take care.
You too.